Welcome everyone. I'm Bonita Juliet from Mass Solutions. I'm hosting this webinar for you today. Thank you for joining our presenters, Summer Aldridge and Ben Lacy. Both Ben and Summer are with Enterprise Ventures Corporation in Johnstown, Pennsylvania, and both experts in their field. We're all experiencing something new and very different right now, both professionally and personally. We're having to learn how to adapt to living in a COVID-19 world, and we all have questions. And that's why you're here with us today. You want to protect your employees, you want to protect your customers, and you want to protect your business as well. So Ben and Summer are here to help you. They'll guide you, they'll provide you information you need to move forward, and they'll answer your questions. During the presentation, you can submit your questions in the chat box at the side of your screen, and we'll put them in the queue for a response. We'll spend the first 25 minutes or so with Ben and Summer, and then we'll follow that with another 20 minutes or so answering your questions and wrap up the webinar by 1 o'clock. So I'll turn it over now to Ben and Summer to get started, and thank you.
Thanks, Bonita. My name is Ben Lacy. I'm with Concurrent Technologies Corporation, which is the parent company for Enterprise Ventures Corporation. I've been with Concurrent Technologies Corporation for nearly 7 years after retiring from the Army as an aviation officer. In my current capacity, I'm the manager for environmental safety and occupational health. So I have the privilege and the opportunity to work with nearly 20 safety professionals, industrial hygienists, and bioenvironmental specialists that really focus on what many of us consider to be one of the most important things out there, and that is protecting our workers and keeping them safe. I'm going to go through the first few slides, then pass it off to Summer and let Summer introduce herself. But so let's get started. A little bit about CTC. It was established as Metalworking Technology Incorporated as a subsidiary of the University of Pittsburgh Trust. It became CTC in its present form in 1992, separated from the University of Pittsburgh in 94, and Enterprise Ventures Corporation, which was the profit affiliate of CTC, was created in 2000. A little bit about us, and again, 450 employees. The biggest takeaway from this slide, other than there's some cool pictures on there, is that we're obviously heavily involved in the manufacturing environment, but we're a Johnstown, Pennsylvania, Western Pennsylvania-based company. We have locations throughout the United States as well as client sites throughout the United States, but again, we're a Western Pennsylvania-based company. A little bit about us, we have some pretty talented folks working for us, you know, in a variety of STEM fields, as you can see by the slide. And again, these folks really are engineers and scientists focused on delivering, you know, ideas and solutions to our clients throughout the United States. So now what we're here to talk about this afternoon is COVID-19 green. So I created a slide here, and I think at least all of us in the course of the last 90 days or so, we've gone into a variety of places, whether retail establishments to do grocery shopping or other places, and we see signage. So you see the one sign that's the folding triangle sign. They're about 123 bucks. You can get them personalized for your business. Or, you know, we've stood in line at Giant Eagle, Kroger, or a variety of places where we've seen the little stickers on the floor that show us where to stand so that we can socially distance and keep separated. Signs are great, don't get me wrong. But when we think about our business interfacing with our employees as well as our customers, it goes a little bit just beyond signage. So just keep that in mind. Summer's going to talk about signage here in, you know, a little bit, but you know, I wanted to talk about, hey, signs aren't the end all be all. But the important piece to this is, you know, OSHA, if we go to the OSHA standards page, there's a COVID-19 safety and health topics page, which gets into this in a little more detail, as well as we obviously know the websites like, you know, the CDC and others that can provide a wealth and breadth of information for us to use within the workplace. I took this picture for a variety of reasons, really as a talking point. what you see in front of you is it's a veterinary office. Palm trees, obviously not in Western Pennsylvania, but it's in the Southern United States. And the point I wanted to make is we live obviously in a changing world. 6 months ago, we would have never thought that we'd be faced with a nationwide or worldwide pandemic, but it really has forced us, in many of our organizations and many of our businesses to think about how we operate. So this vet clinic, what they did is they set up a tent in the parking lot, and they have stalls, and in the stalls they have a number. And on the number of the parking stall, they have the number of the vet. So if you have an appointment, the intent is, at least for this veterinary office, is what they wanted to do is try to keep people from piling up in a waiting room, with Fido and Fluffy, whether they're getting their nails done or getting groomed or going in for an annual, rabies shot, is what they wanted to do is try to create a environment which, the pet owner could come in, pull into the parking lot, call the number, say, I'm in pad 4 or stall 4, or I'm in stall 3. A veterinary technician would come out to the car with a PPE mask and nitrile gloves and take the pet from the passenger side of the vehicle and go back inside, do whatever business needed to be done with the pet, and return the pet to you. So that was their attempt to really try to limit traffic within their own waiting area. So I think it's a great point, but the other takeaway that I have from this is that while we as managers, owners, operations managers, et cetera, sometimes we think that we have to be the ones that always come up with the solutions for the workplace. And that always isn't the case, because I will tell you, whether it's COVID-19, whether it's a potential swine flu that is now supposedly become prevalent in China, or another version of COVID, it's important that we analyze and assess the hazards we have in the workplace, and in many cases this is done through a risk assessment, and then we apply mitigating measures to help abate those risks. We will often find in many of the organizations which I've visited, that really most of our employees, if we have a hazard in the workplace, and the hazard obviously we're talking about today is COVID-19, that our employees often have a solution to help us, mitigate, or protect our other employees from that hazard. So again, assessing risk and, doing a hazard assessment is an important part of our business, but the takeaway from this, like this veterinary clinic, is an employee helped design this idea to help better protect the customers and the veterinary technicians and veterinarians that work in this particular office. When we talk about COVID-19, it's a pandemic that's worldwide. And, that old adage that, bad news doesn't get better with age. I'm not saying that you have to over communicate, but management in the organization, keeping the employee apprised or updated on whether it's organizational or procedural or process changes, or changes in how we do our business, is really paramount. We really need to take the opportunity to set aside time and make sure that we're communicating to our employees the ever-changing conditions, not only in our workplace, but how we support our customers and how we support our clients. The other thing that I want to mention about this is communication just isn't a one-way street. It's best in many cases to facilitate an environment where employees feel as though they're empowered, that if they see something that perhaps doesn't look correct, that they know that they have a venue or a resource, a mechanism to be able to communicate those concerns up through the organization. So, and then lastly, I'd like to mention that, as many of us have recently reopened our business or partially opening or going through the reopening process with the expectation that as we go into the green phase and we raise, the number of, customers, from 50% to 75%, or at some point, we're looking forward to the day in which, we can be 100% open again, is that, if we have an employee that does get sick, that we make sure that we communicate to that, that issue to those, employees that may have come in contact with that other employee. So, just throwing that out there for consideration. What does COVID-19 green mean? A little dated, it's nearly a week old, but we can see this is, Pennsylvania, the Commonwealth of Pennsylvania, the counties, and the statistic was, green through 3 July. You can see the date first reported, the number of cases. The good news is if, I look in April and I, fast forward to July, generally speaking, we see that the curve is trending downward. We've had a little bit of a spike, but probably that is perhaps, due to many of our businesses now reopening, as well as, summer vacation. We probably have, family members or relatives that have come in from other parts of the United States that perhaps have brought, the COVID virus with them, unfortunately. Common prevention procedures. We're going to get in this in a little more detail, but, the governor and the staff have made it very clear that we're going to wear a mask in public. We're going to social distance. We're going to wash our hands for at least 20 seconds or more. Summer's going to talk about this a little bit, but pet peeve of mine, you go into the grocery store, you go to the restaurant, you go to the bathroom, you wash your hands for your 20 seconds, and then you realize that the paper towels are quite a distance away from the door, and the door has a pull handle. So I wash my hands, I have to dry them off, and now I have to go touch a door handle that potentially people that haven't washed their hands have already touched. So easy fix, move the trash can right by the door handle, so as people exit the restroom, they can use that towel to grab the door handle and dispose the towel right in the trash can, or some places they put the trash can right outside the door. So just one of those things that often it's, as we reopen, things to consider in terms of a process standpoint with touch points that we have within, our business. Clean and disinfect surfaces often, that goes without saying, now more than ever. It's a huge importance. And then, limit groups and gatherings and crowds. Right now, we know that number for many places throughout the state is right at 10 people. COVID-19 green phase eases a lot of our restrictions. We do have in-person operations again. We're limiting the capacity of folks that come into our business, but we do have the in-person operations. We put the signage, as we mentioned before, wear a mask, social distance, but, that's something that perhaps we're going to have to ask ourselves is, do we have, if someone, a customer or potential client shows up to our organization, whether we're a financial services business or whether, we're a pre-K or a school of some sort, do we turn that customer or client away just because they don't have a mask? 2 months ago, I probably would have said it may have been a little cost prohibitive to have masks because we know on Amazon and other places, the prices of PPE skyrocketed 2 months ago. But, if you go back online now, that you can see that, many of the masks that we see common throughout the healthcare industry, those masks are now down. If you can buy a 50 pack and it averages out being 49 cents each. So do we spend that 49 cents and give it to that potential client that's coming into our financial services business, or do we turn them away? That's something that you sort of have to decide what best works for your business. Businesses operating at 50% occupancy in the yellow phase, they are, in the process of increasing to 75%. Again, masks are required. Some businesses, and you'll see the list there, are still restricted to 50%. I would fully expect, much to the disappointment of, restaurant and bar owners, is we will probably see that business space continue to be restricted for quite some period, since that seems to be, particularly bars, one of the ways with which the virus is most easily transmitted. And you see the other ones on there, malls, gyms, spas, barbershops, et cetera, et cetera. So, and then we see the asterisk at the bottom, telework, still a requirement for those that are implementing. The Commonwealth of Pennsylvania Safety Checklist is out there. It's easily searchable or findable on the internet. It talks about the signs that are required for the safety measures that must be taken. It talks about the limiting of crowds, the cleaning frequency, protecting your workers, how you do that. We see the bullet on here, keep, groups of workers small. We've seen in many businesses that have gone to shifts. Previously, they were primarily maybe a 7 to 5, 8 to 5 type of business. But in order to reduce the footprint of workers in that space, they've made shift work, or they've made teams, or they've designated work areas within their business. There's a variety of ways that, are innovative in which, you can think about how to perhaps keep your groups of workers smaller, so that we don't have a large group of people in one area. Staff up, as appropriate, and have a plan for dealing with COVID-19 cases, because we all know that there are family members, unfortunately, that come in contact. We know that there are folks out there that are asymptomatic, but I will tell you that as we look at this very closely, the spread of the virus seems to be much more prevalent in social settings than it is in work settings, but that doesn't mean that we need to let our guard down as it relates to our business, because we know, again, this is the first wave. There could be another resurgence of this virus, sort of in conjunction with the normal flu season, whether it be influenza A or B. At this time, I'd like to go ahead and pass it over to Summer. Summer's an industrial hygienist that I work with. She's going to introduce herself and go through some slides. So, Summer?
Hello, my name is Summer Aldridge. I've been with EDC for almost a year. I'm one of the industrial hygiene program managers for the projects that we're working on. Have about 19 years experience. I did 10 and a half years on active duty in the Air Force. And my background is a master's in emergency and disaster management and a bachelor's in occupational safety and health. So I wanted to go ahead and get started on this portion, talking about identifying the controls and hazards, then getting into some of the ways to protect yourself, ways to clean up areas if you do have a positive in your area. So we'll go ahead and get started. Us as industrial hygienists are trained to use the AREC model, and that is anticipate, recognize, evaluate, and control hazards. And this is done with the hierarchy of controls you can see here, with substitution and isolation, then engineering, administrative, and lastly PPE. So first, we're going to look at isolation, ways to isolate yourself. Of course, we have social distancing, making sure that we're maintaining a 6-foot distance from individuals, quarantining ourselves, especially if we've been to an area where there have been some positives, then people are quarantining themselves for about 14 days. Engineering, shielding, as you've seen in some places that you've probably gone to, whether it be restaurants, even hair, nail salons, they'll put up shielding between different booths to keep like a plexiglass piece to prevent you from being exposed to the person that's next to you. Ventilation is another way to engineer out so you can protect yourself. And engineering, the ventilation is just opening up the outside doors and windows. And also another way that if you have an area in your facility that maybe somebody came into that was a positive, you can, if it's a possibility for you to do this, you can temporarily turn off the room fans and central HVAC system if that's a possible way. So that's what it's going to do, is it's going to help you circulate all of that stuff out of there, but also shutting off that HVAC system, it's going to prevent whatever the person that may have been in that area is going to prevent those droplets from getting back into the HVAC system and dispersing throughout the rest of the building. Your administrative, you have training on COVID, different shift rotations, rotating out your employees and having them spaced out at different places throughout your business, limiting the staff and customers that you have coming in and out of there. When you have them coming in, you have a temperature check where you're checking to make sure that they're not at a certain, above a certain temperature, or give a questionnaire, wellness screening. Have you been, out of the country or this place within the last 30 days? Have you been exposed, been around somebody who has been exposed to the COVID-19? So they'll go through the different screening with you. PPE. Mask, we know that we're wearing masks as we go out into public. Face shields, gloves, medical gowns, especially when you're in a medical facility, they're wearing the different medical gowns and gloves and things like that. So these are some things to look at when we're trying to identify and control those hazards, looking at isolation, engineering, administrative, and PPE. So your health and safety are top priority, and your employer is actually responsible for protecting you, but you also have some of your own responsibilities that you should take. Just take a few minutes and look through those, and I'm going to go through a whole list of these, and you can also find more of this information on your CDC and your Department of Health website. So you want to make sure that you familiarize yourself and learn about the symptoms of COVID-19. Tell your supervisor if you're sick. Stay home. You don't want to expose any of your coworkers or any of those that you may run into in the grocery store. You don't want to expose anybody to that. Your symptoms that may range from the fever, the chills, loss of smell and taste, even having pneumonia. These are going to manifest anywhere from 2 to 14 days after your exposure. You also want to make sure that you read the new safety checklist that all of the business must follow. So make sure each and every one of the employees and everybody that comes into your business is aware of those. Wear your mask. It does reduce the risk of spreading or catching the virus. If you're not in healthcare or a first responder, those fabric cloth masks are going to be enough for you. You can learn more about those masks at your Department of Health. It gives you mask guidance. And I'm sure some of you, if you're not using the masks that you would wear in a healthcare, that you have actually used those cloth masks, and people are making those, selling them for you. And so it is very important that you do wear these masks. Keep your physical distance. We want to make sure that we're keeping at least 6 feet from others. If you are working closer than 6 feet, make sure you have some type of physical barrier or shield in place. Washing your hands frequently. I know Ben just mentioned about using soap and water for 20 seconds. If you're not able to get to a sink that has soap or water, make sure that you're using an alcohol-based sanitizer with at least 60% alcohol in that. And then for any of your high-touch surfaces and equipment, make sure that you're disinfecting those areas, whether it be keyboards, it be your doorknobs, anything that everybody is coming in contact with. And I know Ben mentioned the bathroom. The bathroom has got to be the most dirtiest, nastiest place to be, especially when you're washing your hands and you're trying to walk out and you don't want to touch any of that. The thing I do like about some businesses or places that they've actually put those little foot pulls on there, so you don't actually have to touch the door handles. But as a business owner, want to make sure that you're frequently cleaning these areas so that people are being protected. Some additional administrative controls is to stagger your work start and stop time for employees when practical. So we want to be able to prevent those gatherings of large groups entering or leaving the facility at the same time. So if you are able to do that, great. We want to provide sufficient space for employees to have their breaks and meals while still maintaining that social distancing. We want to make sure that you include the limited numbers of employees in the common area. Setting up, different seating areas, making sure that they are facing forward, and not towards each other, so they can't look at each other. So they're all facing forward. Conducting meetings and training virtually. If a meeting must be held in person, you need to limit that meeting to the fewest number of employees as possible. Not to exceed 10 employees if you can, and maintain a social distance of 6 feet. So if you must have those meetings with everybody sitting there, kind of if you set up chairs, and I've seen meetings where, whether it's a town hall meeting or anything like that, they will set up different seats throughout there and make sure that they are set up 6 feet apart. You can still sit there and talk and have a meeting. We just want to make sure that you guys are being protected and maintaining that social distance of 6 feet. Ensuring appropriate staffing. We want to ensure that the facility has a sufficient number of employees to perform all measures listed. So, and that everything is done in a manner that we're wanting to maintain safety of the public and employees. So want to make sure that you do have all these staff to keep, things set up 6 feet apart, cleaning, appropriate cleaning, so everything is disinfected appropriately. We want to control access. So controlling access to personnel into your facility. Want to maintain that order and ensure social distancing also once those individuals get in there. Now, if you do have some non-essential visitors that show up at your business, want to make sure that you try to prohibit that as much as possible. If they're not essential, then you need to schedule another time with them to maybe set up a meeting virtually or some other time that would prevent further exposure to your employees there. Reasonable accommodation. And what this means is that you have some employees there that might not speak English as their first language. So they need to be aware of the procedures and communicating those procedures in either orally or writing in their preferred language. Okay, Ben. Okay. In addition to maintaining your pre-existing cleaning protocols, Pennsylvania has outlined these new protocols. So we talked about cleaning and disinfecting high-touch areas in spaces that are accessible to customers, tenants, and or individuals. So again, your door handles, your keyboards, anything like that that people are going to continue. And if you're in a restaurant, you have a restaurant, the tables, making sure that those are effectively clean. Maintain your pre-existing cleaning protocols. So let's make sure that all areas of the building are, you're maintaining what you have set up for that cleaning protocol, whether you have a plan in place to do that, but we want to make sure that we still maintain those cleaning protocols. Again, making sure you have sufficient number of employees to take care of all of this, to make sure that it is done in an effective manner and ensuring the safety of all the occupants and employees. And then we want to make sure that we have sufficient number of security employees to control access, maintain that order. Okay, in addition to our social distancing and our mitigation and cleaning protocols, businesses must follow the ordered implement. So based on the size of your building and your employees, you will require all customers to wear a mask on the premises. If they cannot wear a mask, then they should not be coming into the facility. We want to conduct business with the public on appointment only. If for some reason that you cannot do it by appointment only, you still need to maintain a social distance and then that 50% capacity. You can also alter your hours of business where it allows you time to clean up the area after you had your business open. So say you want to open your business, I don't know if say it's like a Walmart or something that is 24 hours. You alter it where we're going to close down for 8 hours so we can fully clean our area and make sure everything is disinfected. Install shields or other barriers at register and checkouts. And I'm sure you've seen that as you've gone to different department stores, restaurants, that they have barriers up there to protect you and the cashier that is there. Also, another thing is to encourage use of online ordering. I'm sure most of you, if not all of you, have taken part in providing or had delivery. You've had food delivered to you or you picked it up curbside. that is another way to prevent exposure, a higher, that higher exposure to the COVID-19. We want to designate a specific time for high risk and elderly persons. So our elderly person are high risk that, diabetes, heart problems, things like that, they're higher risk to the COVID-19. Set up a specific time that these individuals can actually come and shop or, come to your business. Maybe it'd be, from 7 to 9 in the morning, we're going to open up our store for the high risk and elderly person to come in and shop, or, come in and, have a meeting or whatever needs to be done. But we want to adjust and designate a specific time for them. Rotating your checkout lines. So with your checkout lines, if you have every other one open for a certain amount of time, couple of hours, then you can shut those down and then open up the other ones so you have time to thoroughly clean everything. Also, what you should be doing with the, each time somebody comes through a checkout line and you have those keypads that they're using credit cards on, you should be wiping those off each time that somebody touches those. There are times that you can do everything at Walmart. If you do Walmart Pay, you do everything there on your phone and you don't have to touch that keypad. But it's important to make sure that you clean those keypads out and then rotate those checkout lines so you can thoroughly clean. Schedule hand washing breaks. Want to make sure that we schedule some hand washing breaks for our employees at least every hour so they can go in and thoroughly wash their hands, doing that 20 seconds of washing with soap and water to make sure that they are being protected also. Cleaning the carts and baskets. Carts and baskets, if they, a lot of times they'll have an area where they will, once you use that cart and basket, I need you to put it right back here so we can thoroughly wash it, sanitize it before we put it back in operation for the next person to use it. Also, they do have those sanitary hand, wipes when you walk into the store where you can wipe down the handle where you're going to be touching. But I know a lot of these have already been enforced, some type of sanitation where they're actually spraying these carts down. So these are some different ways to make sure that you're complying with the different requirements of COVID-19. So if you fail to comply with these requirements, enforcement action can include citations, fines, license suspensions. So it's very, very important to make sure that you're following these different guidelines that are set forth for you. So what do we do if we have a positive? So upon exposure, business are also ordered to do the following. So you want to close off and ventilate. Again, I mentioned ventilating the area, making sure you're opening those outside doors and windows. Again, if you have an area that, has a ventilation system in it, see if you can close it off to there, because we don't want any of those droplets circulating back through the building and exposing other people. Waiting a minimum of 24 hours. You want to wait 24 hours as long as possible before beginning cleaning and disinfection. You probably think, why do we need to wait 24 hours to clean an area? Well, this actually limits the exposure to those respiratory droplets. So if you let it set for 24 hours, those droplets are essentially, they're minimized. But if you do it right away, it's exposing you and whoever is doing the cleanup. So we want to make sure that we wait a minimum of at least 24 hours. Clean and disinfect all spaces, especially those commonly used rooms. And like I said, shared electronics, faucets, doorknobs, etc. All that stuff. We want to make sure that we identify and notify employees who were in close contact with those individuals that may have been positive. Were they within 6 feet of that individual? Was it for 10 minutes at a time? So we need to make sure that we identify those employees that were around them and then notify them, hey, we had a positive. We need to take precautions and go through, the testing or whatever needs to be done. And so you need to make sure that you let them know about that. Again, ensure sufficient numbers of employees to perform these protocols effectively and immediately. So we always want to make sure we have enough people once we do have a positive that can help clean up this area. So these are some of the Pennsylvania enforcement offices. You got your Liquor Control Board, Department of Health, Agriculture, Labor and Industry, Pennsylvania State Police, and local officials. So these are a list of all your enforcement offices that can enforce these requirements. The Pennsylvania Disease Prevention and Control Law of 1955 says that any person that violates any of the provisions of the act or anything that's set forth in all of these requirements can pay a fine no less than $25 up to $300. And if you're in default of the payment of the fine, you can be imprisoned in jail for up to 30 days. So that's why it's very important that you follow the protocols that are set forth in the state. Wearing your mask, cleaning up effectively, making sure everything, all the surfaces are clean. You know, when you do have a positive, the steps that you need to take to make sure that those areas are cleaned up and nobody else is exposed in your building. And this is just your, on July 1st, universal masking, the Secretary of Health, Dr. Rachel Levine, signed into order. And it just basically talks about that you don't need the surgical mask, that you could use the cloth mask, and the homemade masks do limit the spread of infection. So I believe. And that completes my portion. Bonita.
Participants see who they've been talking with.
Bonita, you're muted there for a second. If you want to just repeat, I unmuted you there. So we've gathered some questions here. So I'm going to let Bonita go ahead and read some of these questions off. And then Ben or Summer will kind of jump in and answer, but go ahead and keep submitting questions as you think of them, and we'll go through this whole process.
Okay, so while we wait for Ben to get the screen shared down so people can actually see you, one of the first questions was this, and this one is probably for you, Summer. It says, should disposable masks be discarded after one use, or can they be worn more than one time? Are the homemade cloth masks effective? Do they need to be washed after each use?
Disposable masks should be discarded after one use, and I think that's where people don't understand that, but it is a one-time use only for those masks. Now, with your homemade mask, you do need to wash those frequently. Washed after use, my recommendation, yes. And I know they have more information out there on your Department of Health website as far as laundering, what to use when you're laundering your mask or any type of clothing, especially if there's exposure. But I was looking at some very good information as far as different, types of how to wash that stuff. But yes, as far as the disposable mask, we want to discard those after you use them. I know it might get a little expensive, especially if you're, I don't know how, employees, if they're the employer, would be providing all of those masks. But if you're just say you're a person, an individual is going out into out to shop or whatever, you might not be wearing them as frequently. But yes, I do recommend discarding them after each use and washing them. Again, that information for the state as far as laundering and everything like that is on your Department of Health website and or the CDC website.
Okay, so another question relates in some aspect to the masks as well. There's a question from a participant that says, I work with young children in a preschool setting. How can we keep them safe? What are the rules for masks with younger children? It's hard to social distance and they touch everything.
Correct. So keeping the younger children safe, I'm not saying that they're, that they're more immune to it or anything like that, but I know with daycare is a big thing when it comes to, the social distancing and trying to keep social distancing with the children. One thing that is recommended for children is if you have a certain teacher that is assigned to certain children, and these children have to be assigned to this person at all times, not, keeping the same kids in the same group. Social distancing as much as possible. I know it is hard, especially with the younger, very, very young kids, but they do recommend also when it's nap time is doing the head to foot sleeping arrangements, so they're not right face to face. As far as younger children, I know with the mask, one of the things that was mentioned is 2 years and under wearing the mask. It's not required. However, trying to get any type of age of children wearing a mask has been rather difficult because they're always pulling at their face and, why do I have to wear this? And it's become rather difficult to keep those children, wearing that. But the biggest part that came out of the CDC and the Department of Health is just making sure that you keep those children. Maybe one teacher has 4 children, and that teacher has to keep those 4 children at all times in in that room every day, day in and day out. So there's no outside exposure from others. So as far as, the children, again, it's very, very, very hard for them to keep that mask on. I mean, I have an 11-year-old and she doesn't even like to wear it. So I can only imagine, the smaller children having to deal with that.
Okay, thank you, Summer.
This is Ben. I'd like to add also, weather permitting, is the virus is much more unstable in an outside environment than it is inside. So I think a lot of preschools and school activities have tried to find innovative ways to create, more outside play opportunities, just because the virus is not nearly as stable in an outdoor environment as it is indoors. So perhaps looking at what activities could be moved outside is always an option for, a daycare facility.
Good, thanks, Ben. Another question I see posted here is, I believe my business is following all these requirements you've discussed. How else could EVC help us ensure that we've covered everything? We think we are, but how can you ensure that we have?
We could perhaps, reach out and have a conversation offline, but there's a variety of mechanisms out there, whether it's in the form of a gap assessment or a formalized risk assessment, where we take, an in-depth look at your business and help provide some strategies on how you can improve. We can certainly talk about that offline.
Okay. Thank you, Ben. I do want to point out to those of you who have further questions that on the slide that's probably still on your screen, I believe it is, you'll see the website address. If you go to their website after the webinar, there is a COVID-19 response and recovery page, and Ben's contact information is there. So you're welcome and encouraged to continue the conversation with him. So another question.
I see one more question, Benita. Oh, go ahead. I'm sorry.
I was going to move on to the next question. There is someone here that is asking about, must be something you mentioned about ventilation. It said, does a personal office fan or plug in the wall fan have a similar impact in potentially spreading droplets like an HVAC system would?
Yes, it does. It's still circulating that air and it's pushing it into that area. So if you do have that fan in there, it's just going to push it up, especially if it's one that's a pretty powerful one, that's going to push those droplets up into the air, eventually up into that, more into the breathing zone and up into that HVAC system. So yes, it does have the similar impact of spreading those droplets.
Okay, thank you. Let's see, does anyone else have a question they want to type in the Q&A listing? We still have a few more minutes we can take to respond to questions.
Yeah, I'd just like to throw and add on to the ventilation piece is that most guidance coming out of the CDC and most research indicates that the virus can live longer, in a 68 or 70 or 72 degree setting than it will in a 77, 78 temperature range. So while we don't want to make it uncomfortable for our fellow employees or potentially our customers and clients, one way to perhaps mitigate, the potential for the virus living longer in our workplace is to maybe turn that temperature up, so that while it is a little more uncomfortable, it's another layer of prevention. And so if we normally have it at 72, maybe perhaps we consider turning up to 74, 76 in the workplace, again, to try to reduce, the transmission aspects of the virus.
Okay, here's one. So how would you suggest that I communicate with both my customers and my employees to make sure they feel confident that my place of business is safe? I mean, are there certain signs I should post? Is there a certification I can get? How does that work?
I think if you follow the state of Pennsylvania checklist, that's the first start. Your communication with your employees obviously is going to be a little different tone than I think the one that we have with our clients. But again, reassuring, whether it's in the form of, our splash page for our internal business. So as customers go to log in, to visit, our business, that we remind them that we as, a business are committed to their safety and health, and that we've done, or we are abiding with the Commonwealth of Pennsylvania guidelines as it, relates to business practices in a COVID-19 environment. And then obviously, communicating to our employees, emails, are an effective means. We know the limitations based on size of groups. So if we have an all hands meeting, we have 50 employees, we're not going to pack 50 employees into the break area, because that's in direct contradiction to what the state guidance is. So maybe we have 5 meetings with 10 employees each to just sort of talk to them about, hey, this is what we're doing as an organization, this is where I need your help, et cetera, et cetera. But yes, communicating to your employees and your clients a little different tone and how we do it is something that I would highly recommend.
Okay. Someone else is saying, I've had a customer ask me, what's the difference in the way was I not always being careful with making sure that my business was clean and safe for visitors? So what should I tactfully say that I'm doing differently now to keep them safe in the COVID-19 environment?
I think a natural inflection or starting point would be is we've always taken cleaning and sanitizing as serious in our organization, especially if you're in the food and beverage or the restaurant business. There's always a great deal of, effort placed in terms of, because, while we're not necessarily 6 months ago worried about COVID, we could have been worried about, salmonella or other, perhaps bacterial or virus type issues in the workplace. So, having that I won't say the can line, but we've always take, cleaning and sanitation seriously. We're just increasing perhaps the frequency in which we do it. A common technique, and any of us that have gone to the dentist or doctor's office recently, and it gets into a little bit of what Summer was saying, is you see two bins of pens, right? Writing utensils, one that says clean pens and one that says dirty pens. So, I come to check in at the dentist and I write my name down for the appointment time and I put the pen back. Well, we have, an office worker that's so busy answering calls, working out maybe billing, they don't see that sometimes someone picks up a pen from the clean bin, uses it, and then puts that same pen back in the clean cup rather than putting it in the dirty cup. It gets back into sort of the security or enforcement action. So we've went through the trouble to come up with a mechanism to better protect, our customers by having a container that says dirty pens and a container that says clean pens, but we don't enforce that people actually put the pen they just used in the dirty pen container. So, that's just an example. But again, to get back to the point of the question is, we've always taken cleaning and sanitizing seriously. We're just increasing the frequency in which we do it would probably be, the place which I would start.
Okay, thank you. That's helpful. So I'm going to take one last question. It's just a few minutes before 1. The question is, have you heard any reports that companies have actually been fined for not complying with requirements? Is this really being enforced?
This is Ben. I would say that I am not personally aware, but I will preface that by saying is while Summer shared a slide of a number of enforcement agencies in the state of Pennsylvania, we have a tendency as a society to sort of police ourselves. So I think as we go out and we do our shopping or we do our stuff, we try to return to normal, and we perhaps see that restaurant or we see that business that is not abiding by, state guidelines as it relates to, customer capacity or social distancing, et cetera, et cetera. Like I was saying, I was mentioning fairly recently is, my military experience, I always told the guys I flew with is you're one YouTube video away from, losing your flight status. I would say that also carries forward, or is applicable in the business space. If you're out there and you're not abiding by the state guidelines, all it takes is someone to pull out their iPhone or pull out their smartphone, videotape it and post it on social media. And that's more damage to our brand or reputation than what we probably care to, since we've all worked very hard to build a brand and reputation for our business, and we don't need that ruined by one social media post that catches fire.
Good point, Ben. Thank you. So I'd like to thank everybody for joining us today. The questions were insightful. I think they gave us an added value to the presentation. We learned a little more. Thank you for that as well. If you would like to continue the conversation, you can contact Ben. Go to the EVC website. On their COVID-19 response and recovery page is his contact information. There is also contact information there for his colleague, Greg Jablonski. He too is willing to continue the conversation with you and answer your questions that may not have had time to be answered today. All the attendees on this webinar will get a follow-up that will include the URL for Ben and Greg's contact information, as well as a link to the webinars, because it's still accessible should you want to watch it again or listen or share it with someone else. I appreciate your attendance and I want to thank you. And thanks to Ben and Summer as well. Have a good day.